Pain isn't merely the result of physical sensations, but rather the complex product of the interactions of myriad personal, psycho-emotional, and psychosocial factors. Welcome to On the Pulse, where we take a deep dive into the integrative solutions in the field of medicine. I'm your host, Dr. Rambert. All right, welcome back, everybody. Today we're going to take a look at the use of meditation in the integrative treatment of low back pain. First, we're going to take a look at why we might want to use meditation, since it's not a form of physical therapy, to assist in the treatment of low back pain. And then we're going to conclude with a landmark study published in JAMA, which is the Journal of American Medical Association, a premier and very reputable journal. So back pain itself is one of the most common health complaints in the United States, and over 80% of adults in the U.S. will experience it at some point during their lifetime. It places a heavy burden on the healthcare system, and it's the fifth most common reason for physician visits in the United States. What's interesting is that in 2016, 41% of people with low back pain looked for complementary and integrative medicine treatments for their severe low back pain. And while it may seem surprising that mindfulness meditation may address low back pain, since it's not a form of physical therapy, we do need to take a step back and adopt a more holistic approach to pain and understand that a patient's mental disposition plays a large role in that patient's perception of pain. So why meditation? Well, it comes down to pain perception. Pain is a normal feature of the human experience. In classical yogic texts, it is understood that pain is an unavoidable part of life, and yet suffering is not. In other words, one might experience the discomfort of pain without experiencing suffering. So suffering is a reaction of the mind to the experience of pain. It is the story that the mind constructs around what is happening. Pain itself is a hardwired social alarm of threat, and it's then selected over other competing demands and triggers behaviors that interfere with normal life functioning. Each individual's experience of pain and its expression is a complex product of sensory experience and the meaning it has for the individual. We can go a little further with an exploratory model of pain. So in this model, we understand how normal pain operates to interrupt attention and promote problem-solving behaviors. And these problem-solving behaviors can range from impassive to persevering to highly dramatic and panic-stricken. The process begins when pain interrupts the person's attention and forces them into an unwanted and unwelcome focus on their body. The pain is then appraised as a threat, which makes them more vigilant and drives them towards problem-solving behaviors. Problem is, often patients have no mental tools at their disposal to interrupt this process. For example, a patient may persist with their medication consumption despite the lack of any effect, simply because they're from an analgesic culture that avoids pain and distress. So once again, meditation can interrupt this process of appraising pain as a threat, and therefore interrupts this cascade of hypervigilance, catastrophizing, and avoidance behaviors. Mindfulness meditation instead encourages an atmosphere of kindness to observe our experience. It empowers us to observe that everything is in a constant state of change. It is being present with what is. Everything we experience is in the now. And as we begin to pay attention to the unpleasant sensations that we label as pain, those sensations begin to lose their overpowering nature. It's as if they loosen their grip and begin to soften around the edges. This only happens once we stop trying to push the unpleasant sensation away. Once we interrupt the process of problem solving and fully experience the sensation without labeling it as bad, it loses its overwhelming power over us. And it loses its power over our experience and instead retreats to simply being part of the multitude of background background points of perception in our daily experience. In other words, it becomes no more important than the perception of the chair, the desk, the room, furniture, the blue sky, the houseplant, the buzz of the central air unit. It becomes just one of the other perceived sensations, as opposed to being the overwhelming one that we cannot deal with. In one of the first mindfulness meditation experimental studies, researchers found that long-term Zen meditation practitioners required significantly higher levels of an unpleasant thermal stimulus. So it's pretty common in these studies that researchers use cold as the stimulus that will cause pain. And so in this particular study, these long-term Zen meditators had less reported pain at the same levels of thermal stimulation when compared to age-matched controls. In a follow-up study with an overlapping sample, the authors found that in the presence of, once again, the unpleasant thermal stimulation, long-term Zen practitioners showed significant activation of sensory processing related brain regions, the thalamus, the insula, and then reduced activation in brain areas that process the evaluation of pain, the medial prefrontal cortex, for example. And then there was also a significant relationship between greater deactivation of the prefrontal cortex and the meditative experience, and then lower pain reports. Remarkably, these findings were exhibited during a non-meditative cognitive state, which means that these long-term Zen practitioners weren't actually meditating during this whole experience. They were getting the unpleasant thermal stimulus, they were in the brain scanning device, but yet their long-term meditation training produced stabilized long-term changes in their subjective evaluation of pain. This is consistent with ancient texts that say that meditation practitioners have the unique ability to fully experience the sensory aspect of pain, but to let go of the evaluation of pain. These early findings have since been subsequently reproduced, and meditation-induced analgesia is directly associated with greater deactivation of the prefrontal cortex, the part of the brain that tends to attribute evaluation to pain, and then increased activation of the posterior insula, which once again encodes primary sensations of pain. And there's other benefits to meditation as well, specifically if we loop it back to low back pain. A growing body of scientific literature suggests that meditation may address the markers of inflammatory stress, which have been implicated in the pathogenesis of back pain. When researchers compared participants enrolled in a 3-day relaxation program with a 3-day mindfulness intervention, they found decreased inflammatory markers, specifically interleukin-6, in the meditation group, but not amongst the relaxation participants. All this leads us to our landmark study in 2016. This is a randomized controlled trial published in the very prestigious Journal of American Medical Association, or JAMA. And this study was one of the first to evaluate the effects of mindfulness-based stress reduction, MBSR, which is a meditation technique, on back pain. 342 patients between 20 and 70 years old with chronic low back pain were randomly assigned to either the mindfulness-based stress reduction group, a cognitive behavioral therapy group, or usual care. So cognitive behavioral therapy, or CBT, is a process of training to change pain-related thoughts and behaviors in this case. And so mindfulness-based stress reduction is a training in mindfulness meditation. And both these interventions were delivered over 8 weeks for 2 hours each session. And usual care was just whatever the participants usually received. So they didn't have any changes to their usual care protocol. So in terms of results, at 26 weeks, the mindfulness-based stress reduction participants, the MBSR meditation group, had significantly higher improvement using the Roland Disability Questionnaire, and also both the mindfulness group and the CBT participants were less bothered by their pain. In fact, the findings for the meditation group persisted with little change at 52 weeks for both of these outcomes. And so these findings suggest that mindfulness-based stress reduction may be an effective treatment option for patients with low back pain. In conclusion, mindfulness meditation significantly increased the likelihood of improved clinical outcome. And what's more remarkable is that these benefits in improved pain and function lasted for a full year. And this is not typical for common pain treatments. Finally, meditation empowers patients to make significant changes in their lives. And this is the process that we call self-efficacy. Self-efficacy is when patients feel that their actions matter, which is very important for emotional resilience. They're not entirely reliant on some drug, surgery, or even a healthcare provider. It's a sense of freedom, ultimately, and increased positive expectation, which often leads them to take more positive action and improve their well-being. All right, well, be well, and please let me know if you currently use meditation, mindfulness, and your integrative treatment of pain, or if you will be implementing this evidence-informed integrative strategy in your clinic.